To understand the various ways that medical science can assist reproduction, it is important to understand how the reproductive system functions in both sexes, because the cause of infertility often lies equally with both men and women. The main players in the female reproductive cycle are the pituitary gland, the ovaries, and the uterus. Their activities are closely coordinated. Each month, one or other ovary releases a single egg, an event known as ovulation. It is brought about by a series of complex interactions between the pituitary gland, the ovaries, and the uterus. The pituitary gland is itself under the control of this small area of the brain known as the hypothalamus. A new menstrual cycle begins when the nerve cells of this center secrete a hormone called gonadotrophin-releasing hormone, GnRH, into the network of blood vessels which surrounds the pituitary gland. Stimulated by pulses of gonadotrophin-releasing hormone, cells in the pituitary gland secrete another hormone, follicle-stimulating hormone, or FSH. FSH travels in the bloodstream, reaching the ovaries. There it stimulates the formation and growth of an ovarian follicle in one or other ovary. The follicle consists of an egg, a number of surrounding cells which secrete estrogen hormones, and fluid. FSH helps the egg to mature and prepares it for release. As the follicle matures, the hypothalamus increases secretion of GnRH. This in turn stimulates the pituitary to secrete a second hormone which acts on the ovary. This is luteinizing hormone, or LH. Toward the middle of the cycle, there is a sudden peak in the blood level of LH. This acts as the trigger for ovulation. Within minutes of its release, the egg is guided by suction through the fringed opening of the outer end of the fallopian tube, starting it on a journey which will take 5 or 6 days as it passes down the tube and finally reaches the cavity of the uterus. Meanwhile, after the follicle ruptures, it is converted into this yellowish body known as the corpus luteum. Cells of the corpus luteum secrete the hormone progesterone, which brings about important changes in the lining of the uterus, preparing it for possible pregnancy. In fact, the lining of the uterus, known as the endometrium, undergoes changes in response to hormone levels during the cycle. In the first half of the cycle, known as the follicular phase, the developing follicle secretes increasing amounts of estrogen hormone, which encourages regeneration of the endometrium. After ovulation, there are important changes in the endometrium, aimed at making it suitable to receive a fertilized egg. These changes are brought about by a secretion of progesterone from the corpus luteum. The secretion of progesterone is maintained for several days, but if the egg is not fertilized in that time, the corpus luteum withers, and falling levels of progesterone and estrogen trigger the shedding of the uterine lining as the menstrual flow. The cycle then starts again. But if the egg is fertilized, no menstruation occurs, as the corpus luteum continues to function, secreting progesterone during the first 3 months of the pregnancy. Thereafter, numerous changes occur to support the developing embryo.
Within a week of conception, your fertilized egg, known as a blastocyst, will make its way to your uterus. The egg is about the size of a pen tip. In days, the cells in the egg arrange themselves into groupings. The inner cell mass will become your baby. The outer cells will become the amniotic sac and placenta. The blastocyst then sheds its protective casing in a process called hatching and burrows into the lush uterine wall. Around week 5, your developing baby is the size of a sesame seed. The cells that once formed the blastocyst's inner cell mass begin organizing and arranging, giving shape to the young embryo and forming primitive organs. Your baby's brain and spinal cord are visible through his translucent skin. Right around this time, your baby's circulatory system also forms, and his heart begins to beat. Your baby looks more like a tiny tadpole than a human. He's drawing nutrients and oxygen through the newly formed placenta and umbilical cord. By week 9, the embryonic tail is gone. Your baby's looking more human every day. With protruding limbs and fingers, a defined nose, mouth, and eyes, and tiny earlobes. Your new resident is about the size of a grape and weighs a fraction of an ounce. It's hard to believe how rapidly one cell evolves in such a short time into the unmistakable body of a baby. At 10 weeks and barely the size of a kumquat, your baby is entering the fetal stage of development. His facial features are defined, and his tooth buds are forming. Over the next weeks, his tissues and organs will rapidly grow and mature. The webbing is gone between his fingers and toes, and his nails and fingerprints are developing. Your baby can open and close his fists and curl his toes. Thanks to his developing muscles and reflexes, he's now moving his limbs and kicking up a storm. If this is your first baby, though, you likely won't feel his flutters until 18 to 20 weeks. Through translucent skin, his vital organs are visible and functioning, including his growing brain, nervous system, intestines, and liver, which is making red blood cells in place of the disappearing yolk sac. The umbilical cord is working hard now. One vein delivers oxygen and nutrient-rich blood to your baby. 2 arteries then carry the blood away. Around week 12, the kidneys have begun producing urine, which your baby will soon start excreting into the amniotic fluid. He'll swallow the fluid and the process will begin again. By week 14, your baby's eyes and ears have moved into place, and he can squint, frown, and grimace. You're now beginning the second trimester of pregnancy, which many women say is when they feel their best. Between 15 and 20 weeks, your baby will more than double in size. As his body grows, his nervous system is rapidly maturing. His nerves are connecting his brain to the rest of his body, traveling from the brain through the brainstem and down the spine, and beginning to extend into his torso and limbs. Your baby's skeleton is changing too. The soft cartilage is starting to harden into bone. This happens first in the arms and legs. Sensory development is picking up speed. Your baby's brain is designating special areas for smell, taste, hearing, vision, and touch. At this stage, your baby may be able to hear your heartbeat and voice, so read aloud or sing a happy tune. Your baby may even be sucking his thumb now. At about 18 weeks, you'll start to experience one of the most exciting parts of pregnancy, feeling your baby's movements. His flexing arms and legs may feel like gentle flutters at first. They'll become even stronger and more frequent in the weeks ahead. At 20 weeks, your baby weighs a little more than 10 ounces and measures about 10 inches from head to heel, about the length of a banana. This week is a big milestone, the halfway point in your pregnancy. Between 21 and 27 weeks, your baby's sense of touch is developing, along with his unique fingerprints. When you rub or gently press on your belly, you may feel your baby squirm or kick in response. He can feel his own face now, as well as anything within his reach, including the umbilical cord. He'll keep experimenting with and refining his sense of touch. Around 23 weeks, your baby can swallow. Soon after, you may notice fetal hiccups. Don't worry, hiccups are a normal part of development, and it's common for your baby to have them several times a day. His lungs are also forming millions of tiny branches called bronchioles. Incredibly, your baby is already practicing breathing by inhaling and moving small amounts of amniotic fluid in and out of his lungs. At 24 weeks, a baby is capable of surviving outside the uterus with significant medical help. At 27 weeks, your baby's eyelids may open as a reflex, but he can't see yet. His lips are formed, and he now has tiny taste buds on his tongue. He weighs nearly 2 pounds and is about 14.5 inches long. Now there's just one more trimester to go. Baby are beginning your last trimester together. At 28 weeks, your baby weighs just over 2 pounds. He'll more than triple his weight between now and birth and build a layer of fat that will help keep him warm outside the womb. Your baby's skeleton is hardening. The bones in his head have not yet fused together, which will allow them to slightly overlap as his head passes through the snug space of the birth canal. Billions of neurons have developed and are firing in your baby's brain, creating essential connections that will help him learn in and outside the womb. Your baby can open his eyes now and see the light that filters through your womb. He can hear too, so go ahead and talk or sing to your baby. As your due date nears, your baby will shed small bits of vernix caseosa, the white cheesy substance that covers his entire body and protects his skin from the amniotic fluid he's floating in. Your baby swallows some of these bits, along with other secretions, which pass through his digestive system to become his first bowel movement. At 37 weeks, your baby's skin is pink and soft. He's looking less like a wrinkled alien and more like a baby. He's gaining nearly 1 ounce a day and weighs about 6 pounds. He's now considered full term. In preparation for birth, most babies will turn so their head is facing downward. Your baby will stay that way, head resting in your pelvic area.
Thank you.